How to Negotiate an Evolution in Healthcare. Dr. Carney?
Well, first, I'd like to have a memorial, and my partner, William Boswell, I just want to thank you for the opportunity to come and speak. You know, certainly the Rotary and a lot of the members have been influential in the philanthropic support of all the facilities in the city, particularly the memorial. And so let's get into it. What is the mess? Everybody in the world is anxious about what's going to happen. It has both national and international repercussions, to the point where now we're at a partisan divide. We really don't know how we're supposed to react to the impending change in healthcare. I guess before we figure out what we're going to do about it, we need to know how we got here. And there's no question that poverty and poor education, although we don't talk about it, are principally responsible for part of the evolution in how medicine has become so cumbersome. You know, certainly if you look at it, probably 64% of the cost of all Medicare expenditures are attributed to only 10% of the population. And that 10%, although it's not completely uniform, closely parallels those who are extremely poor. They have poor access to primary care, they require multiple procedures, they're poorly compliant. And so we really have failed to deal with poverty, and consequently it's tipped over our healthcare system. Why else? We do a poor job of educating the public on what's important and what priorities for. Certainly every single thing on this list probably affected someone in this room or some family member. But you know, if you watched the NFL game last night, you think that breast cancer is probably the most paramount problem in the United States, and it certainly is. It's a huge issue. It affected me personally and a lot of our family members. But in comparison, you can see that we really need to get control of some other medical disease. Heart disease grossly overwhelms the death rate in the United States, far above almost all cancers combined. ARDS, which is nothing more than, you know, your immune system fights infection, and when your immune system becomes somewhat exaggerated in response to an infection, it can actually hurt you. That's why you get arthritis. Your immune system's kind of revved up in your joints, or gingivitis. Your immune system's over revved up in your gums. When that happens in your lungs, it can kill you. And probably nobody in here has even heard of ARDS, or very few of us, despite the fact that there's probably 4 or 5-fold more deaths attributed to that than breast cancer. And so we got to make the public a little more aware of what the problems are before we can fix it. Corporate greed, certainly this is the problem. It's a huge problem in the United States. Physician greed, you can add in there too. I mean, we're as much responsible for it as are the corporations and pharmaceutical companies. You take a pedicle screw, so those of you who've had back surgery, this will make you nauseous, but this is the spine. And so when you have a disc that bulges, they suck that disc out. Well, they have to put in a scaffold to hold it together. Otherwise, it'll collapse on itself. And so that's what the scaffold looks like on the left. And the diagram you see in the middle, they take a titanium screw, it's most of them made in Germany, and they have to screw that bone or that plate into the bone to hold it together. In China, because of the titanium, that screw costs $15. You wouldn't want to hazard a guess what that costs in the United States, right? On average, it's about $257 for a 7mm screw. And so, again, physician greed, our associations with corporations and corporate greed are driving this problem that we have in healthcare. Lack of personal responsibility. Certainly, any governmental subsidy or insurance program doesn't encourage a ton of personal responsibility. Again, this is a little generalization, but it certainly is a problem when it comes to healthcare. We looked at a group of girls, we took a whole group of teenage girls in urban Atlanta where the teenage pregnancy is exponential, and the consequence of teenage pregnancy is preterm delivery. And so we looked at over 100 girls and we said, can we get them to come to their prenatal visits, to show up? Because we know if we can get them there, if they can take their vitamins, if they come routinely, the risk of preterm delivery goes down exponentially. We had poor compliance. At best, we had 18% initially in the prenatal visits. So someone came up with the genius idea that we were going to issue them all an iPhone 4S. And they would have to show up and come up with $5 every month and come back every month. Otherwise, we'd shut the phone off. And with the consequence of that simple thing, the prenatal visit rate went to 97%, from 18%, and most importantly, rather than a third of those girls delivering preterm, only 8% of them delivered preterm. We have to do something to engage the public to have some sense of personal responsibility. Overregulation. So this little guy, 1.5-year-old, who probably should have been in bed, shows up Saturday night about 2 in the morning. He was crawling around his mom's apartment and ate this quarter. We couldn't get it down. And so when we can't get him to kind of either choke it up or we can't get him to drink it down, we have to go in endoscopically and pull it out. So this child, the beds were full at Memorial that night. And they allowed me to just admit him directly to the operating room. So he came, and the operating room wasn't busy, and so we swept him in there and took it out, and he was in the recovery room and went home. His whole total time in the hospital was about 60 minutes. The number of pieces of paper to deliver his care was 74 pages. 6 pages for a nursing intake form, 5 pages for preoperative assessment, 5 more pages for discharge instructions to the patient for a 6-minute operation and a 60-minute hospital stay. It's paralyzing our ability. It requires so many more personnel to get the administrative paperwork done, and it adds to your expense. And the dilution of physician and nursing talent, certainly this is underestimated. The competition that we have in medicine, in big business, in corporate enterprise, in industry is so much more tremendous now than it has ever been before. And there's no way that we can compete for the brightest and the best students. It's difficult. The job is not that glamorous anymore. The restrictions are difficult. There's no real control in tort reform, and so it's hard to be a doctor. You know, the reimbursement still is pretty decent, certainly above average, but it's certainly consuming. Probably about 54% of physicians will be sued successfully at least some point in their life, whether it's solved out of court or within court. So it's a challenge to get people to want to become doctors. And so we're going to change, and there's no way around that. We're at an impasse, and we've proven through the Affordable Care Act that we're going to have to make some sort of change. And so we need to know what we're going to do about it. My dad once told me, and I think he was paraphrasing, I don't think he came up with this, but you don't drown by falling into the water, you drown by staying there. And so we need to think about what we're going to do. We're all about to fall in the water. And so we need to know what we're going to do about it. Well, if I were to ask you, what do you need to do to prepare for Obamacare or the change in healthcare, most of you are going to say this. What's it going to cost? And how's it going to protect my family? That's kind of your priorities. But I think for us to be smarter and to be ahead of the curve, we need to think about a few other things. So what's important to you? Well, first of all, as an adult, if you think about your health care and whether you're going to have a change in your health care plan, there are 2 things you need to remember. One, the thing that's going to affect your wallet is your access to good primary care. The thing that will likely affect your life is your access to appropriate hospital and specialty care. And so that's what you have to keep in the background as you decide what plan you're going to have for your employees, for yourself, for your family. Preventive care. So why does it matter? Well, first of all, what do you want out of your primary care doctor if you're going to pick? Because they have a system to ensure preventive health care measures. It's a pretty broad statement. It means a lot of things, right? But why is it important to you? It's the single most likely thing to cost revenue out-of-pocket expense if you don't maintain normal preventive care measures. You know, again, we go back to what we know about the world, right? 245 billion. That number is supposed to exceed 300 billion for diabetic care in the United States in 2013. It's crazy. And yet we sit back and hear all the day, we got all these people doing unnecessary procedures and expensive medicines. The neurosurgeons, right? Probably the most lucrative specialty in medicine. They do wonderfully well, right? And we think that they're kind of pillaging the system. When you look at it closely, if I took every single dime spent in 2012 on every single neurosurgical procedure performed in the United States, it's less than is applied to the Lancets to check blood sugar. Common medical disease so grossly overwhelms the medical system that all the procedures lumped together, all the surgeries, all the unnecessary MRIs, truthfully pale in comparison to just getting someone to keep their blood sugar down, keep their blood pressure controlled, quit smoking. Why else is preventive care important? Well, you know, you've seen this, right? Everybody, maybe at some point in their life when they had a kid or knows a kid, saw this book. Preventive care is important because they can educate you about what to do with common illness, whether it's a common cold or constipation. I'll tell you one thing I've learned in 7 or 8, almost 10 years as being a physician, that this taro gummy, that guy's a liar, because not everybody poops. I don't think anybody does. Certainly none of the children in Southeast Georgia do. But again, $250 million spent on the management of constipation with unnecessary x-rays, imaging, medications that are prescription form, rather than just over-the-counter simple remedies that can be accomplished. And certainly your primary care doctor can help with that. Why else? Well, if you look at medical errors, this is a listing of about 85% of the medical errors. So you see that 35% are primary care internal medicine. Does it mean Dr. Spitell is dumber than I am? I don't think so, no. Actually, really what it means is they just have control of the major denominator, right? There's so many more patients that see primary care that you expect or anticipate a lot of care within primary care. So it's important when you select a healthcare program, you got to pick a good one. And so then again, what else do we need out of a primary care doctor? Do they have a network to transition care? huge area that we don't pay attention to, we never paid attention to in the past. So many errors are made when people come into the hospital, they're received by a different set of doctors or nurses or caretakers, and then they get transitioned back to the primary care office with little, if not any, communication. And there are so many problems that are encountered as a consequence of that. People missing medications, premature death, insufficient use of blood thinners or overuse of blood thinners. It's just a big problem. And so you want to know that your primary care network has a method to deal with that. How do they deal with the patient, you if you get admitted, or your grandmother or your mom? How are they going to make sure that there's a safe transition of care back to the primary care setting? Are they available evenings and weekends? Certainly the pediatricians in town have done a great job of this for a long time. The adult colleagues haven't really jumped on board as much yet, but they plan to, and they're going to need to. Your out-of-pocket expense is going to probably triple with any change in the healthcare plan if you enroll. And so, consequent to that, if they're not available after hours or on weekends, it's going to be time lost from work. And if you want or plan to stay out of the emergency room, you're going to have access to your primary care physician at odd hours. Overuse of physician extenders. There's no question we have some great physician extenders. Nurse practitioners have really helped a lot with the care of medicine. The reality is this, however, they're not equally trained to the physician. Statistically, if you're an adult patient over 60 and you have more than one medical problem, the risk of an error if you're seen by a physician extender is about fourfold of that if you've seen a primary physician. And so if you're doing a simple acute visit, or if you have an isolated problem or a single system problem, you're probably fine. But if your primary care network has one physician with 15 or 20 nurse practitioners, there's no way for that person to successfully or safely supervise them all. And so you want to be sure that there's a good balance. We need them both. Do they submit prescriptions electronically? Again, a third of all medical errors are prescriptions. Interaction with medications, overdosing of medications, and there's no way that any person can remember all the information. The use of electronic prescriptions just eliminates that. We have all these flags that tell us that we're given a medication that may counteract with either something you're eating, your diet, your other medications, or that you're given the wrong dose. Is your responsibility clear? Is your primary care doctor, any evolution in healthcare that's going to come forward out of this Obamacare plan is going to demand that we have more patient responsibility. And because we've done such a poor job of educating you, you need to know and you need to be engaged with a primary care physician that's going to very clearly state your responsibility. Tell you what you need to do to go to the emergency room or not go to the emergency room. Tell you what's an acute visit or what's not an acute visit. Tell you how you can be smart about the use of medications. And then do they emphasize end-of-life care plans? And this is big. This is a real problem. So if you look at all the healthcare money, all the money that you're going to put into healthcare in your entire life, about 55% of that is exhausted in the last week of your life for most people who don't die suddenly. And so we have to do something about this end-of-life care plans, right? We have people show up all the time. We do all kinds of heroic methods and efforts for about 2 to 3 weeks to no avail. And it's exhausting, and certainly if you're going to be responsible for a health savings account that may be passed along to your family, you really want to be smart about the way in which you manage this. Additionally, I just wanted to show you here that it's both extremes, really. As you can see on the right graphic there, the children less than 1, not only do we have to worry about the end of life, but we have to think and be more thoughtful about what we're going to do about preterm delivery of extreme preterm infants, because it's exhaustive, it's costly, and our ability to sustain these children is going to add to the healthcare expense as time goes on. What else? Do we have access to specialty care? As I talked about this earlier, again, as an adult, it's critical that you have a good primary care physician, because that's going to discreetly affect your wallet. What's going to discreetly affect your life is, do you have appropriate access to hospital and specialty care? And so does the network that you join, does it have access to well-trained, bona fide specialists? Specifically, are they specialists who use quality assessment measures to ensure that they're doing the right thing? Are they up to date? Are the specialists well-trained? Are they well-qualified? And are they paying attention to their outcomes? Well, finally, it's going to be important for us to solicit the help of this group as we embark upon trying to regionalize healthcare, not only in the city, but in the region for children. It's been a long-standing effort, but we certainly have been remiss in our responsibility of doing that. In the city of Atlanta, they've finally come to a consensus and a decision that they need to regionalize or compartmentalize healthcare for children, because there are too many mistakes and too much redundancy of effort to try to sort of fragment it. And so why is that important? Well, we do quite a few appendectomies. We serve the whole region. We serve about 250 miles in almost all directions. And over 5 years, we did 450 appendectomies. And we noted that the people that were received locally had about a 1% complication rate. And that the people that we saw from that were transferred in from various places, from Douglas to Waycross to Statesboro, it didn't matter. We had as high as 15% complication rate in those patients, and we tried to figure out what it was. So you're sitting here thinking, this doesn't really affect me because I'm sitting back here with my Blue Cross PPO and I'm going to be fine. It does affect you, and this is why. We looked at about 50 different parameters that would be individual predictors of why someone had a complication, and two things came out. One, if you were Latino and you lived in Middle Georgia, their insufficient primary care and delay in access to care led to a 30% complication rate as compared to one. Okay, and so we've done some educational efforts in that community to get them access to care and to get them into the system a little more quickly. More importantly, it's now become a risk factor in South Georgia if you're a child to have commercial insurance. I've never before seen that, right? We thought that the indigent don't get care. That's actually not the case. Because of the limitations of access, the commercially insured patients are skimmed off the top. They're not sent to regional centers. People that are less qualified, less skilled, are more likely to take on a complicated case if the patient's commercially insured. The consequence is complications we've never seen before. 18% in the commercially insured population that are in the secondary ring referral, 50 to 100 miles from Savannah. And so you're not protected by just a simple insurance, a good quality insurance plan unless you know what you're supposed to be getting. Well, this is probably the most devastating evidence of this. So about 5 years ago, we had two patients show up at the same time. A CAT scan, if you've never seen one, is nothing more than if the patient's lying down like a loaf of bread with their head behind the screen, the feet sticking out, and it's like little slices of bread coming down. And so you're looking at one of those slices, and what you see there is a slice, the bones and the V shape, or like the pelvis, and then you see that big mass in the center. Two kids showed up at one time. One, seen by Stevie Cray in the pediatrician's office in town, and he astutely enough picked up that mass on physical exam and sent him to appropriate specialty care in our office. The other was seen in Statesboro and then transferred to a local facility for non-specialty care. What was the difference in that? So the first girl, they thought actually instead of having a tumor, had an ectopic pregnancy because the hormone could secrete the beta-HCG that we look for pregnancy. And so they went flying into her abdomen with a huge incision. You can hear it. They went into the abdomen very quickly with a huge incision, accidentally fracturing her tumor and spreading it throughout her body. What's the consequence to that child? 5 operations, huge incision, they injured her bladder, disseminated the tumor. Consequent to the tumor, she then recorded chemotherapy, which has about a 90% chance of sterility in this 15-year-old girl. She missed 9 months of school and cost $425. The other patient, the Stevie Cray, enrolled in the system that's appropriate to manage that patient. Same problem, same size tumor, different operation, right? 3 little small incisions, 1 operation, effectively managed, cures her tumor, no chemotherapy, no complications. She's out of school for 3 days and it's $12,000. The consequences of not obtaining appropriate specialty care, particularly for children, can be devastating. We talked to Dr. Malin earlier. All of us, the most devastating examples we have of not soliciting specialty care are almost always in children, and that's why we're going to, at some point, come back and utilize this group to help us kind of regionalize that in town. Again, staggering difference, right? Well, finally, access to hospital care. Just a couple notes here, but certainly, do they measure quality? It's kind of overstated, and people don't know what that really means, and we're still trying to figure it out ourselves, but certainly, does your hospital have a system that they're going to routinely and judiciously try to ensure that you're providing the best quality they can provide you? And is it transparent, and is that information given to you as the public? Do they employ physicians? When you look at your healthcare package, eventually it's going to go to an accountable care organization where there's one payment for a certain diagnosis, and that's going to include hospital care and physicians. In the setting where physicians are somewhat aligned, particularly specialty care physicians, when they're aligned with the hospitals, it's going to be cheaper for you because there's going to be less bidding for the same dollar. And then again, are they interested in education? It seemed at one point that you'd never want to be in a hospital on July 2nd because we had all these new residents walking around. You might get killed by one of them, right? It's become more and more evident over time that because of the requirement, hospitals are busier. So if the physicians can't be around, they have to use physician extenders. There's no question that statistically you're much more beneficial or benefited by being in an area where there are residents around. It's a safer environment despite the misconception that it's not. They're immediately available, they're engaged in trying to figure out your problems, and although they can cause complications, just like all of us, it certainly seems to be beneficial to you to have them engaged. And so is the hospital interested in education? Well, let's finish it up. Something's going to happen, right? We're not sure what's going to happen in this Obamacare, but we have such partisan divide that it's critical. We're at a critical impasse, and we can't make any forward progress, and so this is going to fix that. Whether right, wrong, or indifferent, it's going to drive the car into a wall and make such a mess that they're going to have to find a way to fix it. And I think it's going to be fortunate to do that. there's no question, like we saw in the VA system, that anytime you get government involved, there'll be some limited rations, but certainly it will help eliminate some unnecessary expense. I think the third one for sure is going to force a living will, and finally it's going to hopefully